Hello, I'm James Ryan of Samaritan Medical Group Orthopedics, and today I'll be speaking about total hip arthroplasty, also known as total hip replacement. This is a model of a total hip replacement. What you see in clear plastic represents your bone. This is the pelvic bone with the thigh bone down beneath. There are 4 parts to a hip replacement. First, there's a stem that's placed down the center of the thigh bone once the damaged ball is removed. And that can be held in place with bone cement, or the implant can be made of a material that allows your bone to grow onto it. Either way, this piece of metal becomes part of the skeleton. On top of that goes the ball. On the pelvic side, or the socket side, there's a titanium shell that's placed into the socket, and that has a coating on it that allows your bone to grow onto it. So that piece of metal becomes part of the skeleton. Inside that titanium shell is a polymer liner, and that locks into the titanium shell. That liner is highly polished, as is the ball. These pieces come together, and that's the hip replacement. The operation itself takes about an hour and a half, and the hospital stay is generally 1 day. So the surgery is performed on day 1, you spend the night in the hospital, and go home the next day. We have some patients who do go home the day of surgery, and others that stay longer depending on their medical needs. While you're in the hospital, you see physical therapists, occupational therapists, nurses, a whole host of people that get you on the road to recovery, but most of this is done at home with the help of family and friends. We start you on a variety of medications while you're in the hospital. We'll start you on a blood thinning medication to help prevent blood clots from forming in your legs, because that can happen with this type of surgery. And if blood clots form in the legs, they can travel through your bloodstream and go to your lungs, which can be life-threatening. In addition to that, we'll do many things to help prevent an infection. Anytime surgery is done, there's a chance of an infection. With metal and plastic inside, it's a much bigger problem because the implants cannot fight an infection, and it always requires more surgery to get rid of. So we will give you antibiotics during and after surgery. We'll give you special soaps to clean your skin before surgery. We'll also check your nose and your urine for bacteria before surgery. All of this to help reduce the risk, but it is still there. The things that increase the chance of an infection are those who have diabetes mellitus, those who use tobacco products, and those who are overweight and have extra tissue in this area. We do a lot of things before surgery to help get you ready. We will have you see your primary care doctor. He or she needs to tell us that it's safe to move forward, that your heart, lungs, and kidneys are working well. In addition to that, we'll have you go to an educational class to teach you about what to expect in the hospital and introduce you to people you'll be working with. We'll get blood tests, urine tests, EKG. Also, our anesthesia providers have the tools they need to do your anesthesia safely. We use a spinal anesthesia, which means a needle in your low back. You become numb from the waist down, and then you go to sleep on top of that. But because you're numb from the waist down, you don't need heavy narcotics, you don't need heavy sedatives, so you don't need a tube down your throat to help you breathe. You breathe on your own just like you would sleeping at night. It's a much safer way to do the anesthesia. We see you in our office about a week or 2 before surgery. You see our physician assistant at that time for a preoperative visit, and he'll review a number of things with you, answer any questions you have, and make sure all our ducks are in a row. The other complications that can arise with surgery include fractures of the bone, damage to nerves, damage to arteries, damage to veins, changes in the length of your limb, and medical complications like stroke, heart attack, and even death's a possibility, but the chance of that happening is very low. In addition, one of the greatest complications includes the hip popping out of the socket. As you can see, there's nothing holding the ball in the socket. It's just the force of gravity and the tissues around the hip. So in the future, we'll have you avoid certain positions to help prevent that from occurring, especially while your tissues are healing. The way I do the surgery is with an incision at the side of the hip. In addition to that, pins will be placed into the pelvic bone during the operation. Those pins will be attached to computerized equipment that are detected by a camera system in the operating room. It's called computer navigation, and it allows me to place the implants very accurately, very precisely, and to adjust your limb length to exactly where it needs to be. Thank you for listening today. We look forward to seeing you in the office.